New tonight, Des Moines is facing a child care crisis. The pandemic has created worker shortages that are contributing to fewer child care options in Des Moines. Now, many parents are on waiting lists, hoping a spot will open up so they can get back into the workforce and continue providing for their families. Meantime, child care providers are trying to provide quality child care while they lose caregivers. Both parents and providers say something needs to change to keep our economy going.
What is that?
It's circus.
As much as I'd love to be a stay-at-home mom, it's just not feasible anymore.
Samantha Harms-Kedley is a working parent in need of child care and a child care provider.
Right before COVID really hit, we were working on expanding the center, and that's totally gone to a halt.
Harms-Kedley is the child care director at Child Development Center in Des Moines. She says they've had to close classrooms with staff shortages and close rooms when kids get COVID. A mom of 3, she says it's getting more difficult to find good child care.
He just needs this. He needs to be able to run around and be a crazy little boy.
Bobby Joe Sheridan with Des Moines Public Schools is also struggling to provide care.
Yeah, so pre-pandemic, if we would have a job posting, we would get tons and tons, like 50 to 75 applicants.
Now, Sheridan says when Des Moines Public Schools posts a child care position, they may get 1 applicant, creating a child care crisis.
It's heartbreaking. It's a no-win situation.
Pay ranges from $9.50 to $12 an hour.
Compare that to sometimes working at Target, where you may make $15 an hour. There is a huge disparity there.
She says they're doing all they can to recruit qualified staff with COVID protocols.
It's really hard when you have families that are like, please, we just want our kids in our program, but we have to say, unfortunately, we don't have room.
There's a spider on your head.
Cheryl Johnson, Vice President of Community-Based Programs of Children and Families of Iowa, is hoping the state will offer more support.
We always have a wait list, and that wait list has absolutely been exacerbated by COVID.
Her center did receive extra assistance from the Department of Human Services to help with some of the COVID costs, but it's still a burden for many families reliant on DHS child care assistance.
That's landing on our legislators, right? It's on the state, it's on DHS to really consider a fair rate for providers in order to be able to provide what we need to provide.
Providers say at this rate, Des Moines is on track to become a child care desert, meaning an area with little or no access to quality child care, according to the Center on American Progress.
I don't even want to think about what we're headed toward. If families don't have child care, they can't get to work. If families aren't working, they can't financially sustain their family. Employers need workers. So really, child care is kind of the crux of all of that and all of our economic sustainability. And then our workforce, crumbles because of that. And so we need to kind of get back to basics and put value on our child care providers.
I mean, really what we are doing is building future generations, right? We're building so much when we work with these kids. It's not just babysitting.
Providers say they need more direct ways to put money in staff pockets that doesn't involve asking parents to pay more. Now, the providers tell me they rely largely on local organizations like the Greater Des Moines Partnership for donations to maintain pay for providers. Governor Reynolds plans to increase the amount of children each provider cares for and a new $1,000 retention bonus.